Hello, I'm Shuni from MSK MRI.
Today we will be discussing the anatomy of the medial knee attachments. First, let's look at the superficial medial collateral ligament. This is a band-like structure with one femoral and two tibial attachments. It measures about 1.5 centimeters in the anteroposterior direction and is around 9.5 centimeters long from the femoral to the distal tibial attachment. The femoral attachment of the sMCL was previously thought to be on the medial epicondyle. However, recent studies suggest it is actually 3.2 mm proximal and 4.8 mm posterior to the medial epicondyle. Another recent study indicates that the superficial medial collateral ligament covers the medial epicondyle, with its center attachment 1 to 2 mm proximal to it. The superficial medial collateral ligament has two tibial attachments. The proximal one blends with the distal semimembranosus tendon sheath. The proximal tibial attachment is located 10 to 12 mm distal to the joint line and primarily attaches to soft tissues. This is the superficial medial collateral ligament. The semimembranosus tendon is visible. At the distal aspect, the direct and anterior arms of the semimembranosus tendon can be seen, and it is evident that the superficial medial collateral ligament is adjacent to this area. The superficial medial collateral ligament is attached not to the semimembranosus tendon itself, but to the tendon sheath. The distal tibial attachment of the superficial medial collateral ligament is broad, situated 6 to 7 centimeters below the joint line and deep to the Pes Anserinus tendons. The Pes Anserinus tendons, which are the Sartorius, gracilis, and semitendinosus, attach to the anteromedial aspect of the tibia. Understanding this anatomy is important to recognize subtle Stener-like lesions, as the interposed Pes tendons can prevent the superficial medial collateral ligament from healing in its anatomic position, leading to chronic valgus knee instability. In this patient, we can see medial collateral ligament bursitis. The red structure is the superficial medial collateral ligament, and more superficially, we see the yellow Sartorius, pink gracilis, and orange semitendinosus tendons in that order. Next, let's discuss the deep medial collateral ligament. This is a thickening of the medial joint capsule, closely associated with the medial meniscus. The MCL bursa lies between the deep MCL and superficial MCL, separating the superficial ligament from the underlying deep ligament and medial meniscus to reduce friction during knee flexion. On the coronal image, we can appreciate the deep MCL as a distinct thickening of the joint capsule, paralleling the superficial MCL anteriorly. The posterior border of the deep MCL blends with the central arm of the posterior oblique ligament. On the axial view, we see that the superficial MCL fuses posteriorly with layer 3, contributing to the formation of the posterior oblique ligament and posteromedial capsule. Layer 3 consists of the deep MCL, posterior oblique ligament, and oblique popliteal ligament. In cases of MCL bursitis, the superficial MCL and deep MCL become more clearly delineated from each other. Thank you for watching. If you found this video helpful, please like it.